But on top of that, the epidemiologist colleagues, they are looking at understanding what happened in that boat and what were the interaction, especially with the case that were previously confirmed. So this is a way for us to get all the pieces together and have the maximum information to be able to assess any risk for this person and give them the right recommendation. Yeah. So that is ongoing, and what is ongoing will be obviously communicated to the team on arrival. When I say team on arrival, for us it's very important that all passengers and crew members, we should not forget about crew members, absolutely, are assessed when the ship has arrived by a trained medical team. All
so
right?
let me just go back a second.
Yeah.
Because that's a lot of information. I think people are curious about this, but just to chunk it out a little bit. So you said we've been working with a number of colleagues, and I've listened in on some of those discussions today as well. But who are the types of colleagues? What areas of specialization need to be involved when you're writing this kind of guidance on disembarkation?
So we'll discuss with a lot of different expertise. The first one will be obviously my epidemiologist colleague. So they are the one helping us stratifying what could be the risk following certain exposure. They are the one also that will help me look at all the parameters of the disease. What is the incubation period, what is the period where it's most infectious, all this kind of detail. So they will really help us have the best understanding we can based on previous information and evidence.
And previous outbreaks that
exactly,
these experts have worked on.
Yeah. How we should just organize
yes,
the public health measure. Then,
because it's not something that exists on the shelf. A hantavirus outbreak on a boat that's been on the water this length of time with this many of people, with people who've gone off,
it's
people
a bit,
have died on, it's very complicated.
And it's a bit unusual, as people can see. So,
and we've been asked for help. The
exactly,
Spanish authorities have asked us for that kind of guidance. The ship's captain has asked
exactly,
for that kind of guidance. We've been in this very close discussion as well. So it's something that the World Health Organization has expertise on and is called in a situation like this to share that expertise.
Yeah, totally. So the epidemiologists will also help us outlining the type of contact and what happens when you're considered a contact. But I think we will discuss that a little bit later. Yeah. So then I will discuss with colleagues that are specialized in infection prevention and control to define the adequate level of what we call personal protective equipment, both the passengers and the crew members, but also the health assessment team will need to wear when they arrive while doing the assessment.
So PPE, we throw that word around a lot, but that's masks. If some eye covering is needed, if something more is needed on
gloves, for
well,
instance,
so,
it will all depend on what is the risk.
Yes.
And there will be clear explanation for everyone to wear this type of material.
This type or that type, depending on the situation.
On the situation.
Okay.
Yeah.
And this is guidance that WHO is developing. We share it with the national authorities, with the boat, and so on. Spain, in this case, is the national authority. And then they take that guidance and interpret and use it based on their judgment, their analysis of the circumstances, their preferences as well. So we offer it as guidance, it's taken as it is.
But just to mention that we are talking with colleagues we had interaction with at WHO, but this also includes a lot of external experts. Like just this morning, my colleague from Infection Prevention and Control, they organized a call gathering people from the UK, from Argentina, from Chile, and I'm missing a lot, so I don't want to list them all, but with a number of colleagues so that first we can hear from countries who have had experience with this disease and also gather our thoughts so that we can be all aligned based, or at least the most aligned as possible. And WHO made this recommendation, and then country can adapt depending on the context. Yes.
I just want to ask you, there's something that people are also curious about. They hear us, again, use the words contact tracing a lot, but it might not be clear to them what contact tracing means. It can even sound a little bit intimidating. So when we are doing contact tracing or recommending how it is done, what does that mean? Is it concretely phoning people, visiting people? How is it done?
So that's a very good question. How is it done? So first, so if we take the example of this boat, right? Contact tracing will be based first on assessing the level of exposure a person may have had. And they will be assigned a level of risk. And so, corresponding to this level of risk, people will first receive, the first thing they will receive is what they should be doing, what they should be looking out for. For instance, what's one thing that is certain, they will be asked to take their temperature as possible with a thermometer every single day for 42 days.
Because having a fever is an indication that your body is fighting something.
Exactly, and so you need medical assistance to understand what could be the cause. They will be asked to be checked every single day for other symptoms that could be suggestive of early disease.
So feeling unwell,
myalgia, headache. They will be also provided with whom to contact in case they are not feeling well.
So who they need to reach out to, a phone number and an email address of who they should reach out to if they're not feeling well.
Exactly.
We saw that recently with a case in Switzerland where the gentleman wasn't feeling well. He reached out to his family doctor who recommended he speak with the hospital. And that's how he is now in care.
And in some instances, so it's up to the national authorities, Spain or where the people will go next or will be repatriated to.
Yes.
And it is up to the country to organize, but and again, this will depend on the level of risk that is assigned. And we generally recommend in-person contact tracing. What does it mean? It's like daily, medical team or one or two people will come to the person's place and they will arrange for a time that fits everyone as much as possible. And the people evaluating the contact will take the temperature just to check if everything's fine. We'll ask a couple of questions and we'll answer any questions the person may have, or could also, if there are specific questions or fears, they can help out with that. In some other instances, the national authorities may decide that only a regular phone call, so every single day at the same time, can be sufficient. And also we see that countries can be quite innovative. Sometimes it can also be through an app or something like that. So that will be organized by national authorities.
All right, sounds good. Thank you very much for explaining that. It's something, as I said, that we mention a lot. And then I'm going to answer a question next, one that we've been seeing as well. There's been discussion about how hantavirus cases are treated. We know that there is no specific treatment or cure for hantavirus, unfortunately. However, we also know, we've seen this in previous outbreaks, that if a person arrives to care early, as soon as they have those mild symptoms that Anais has been speaking about, they have a chance to have their symptoms treated. If there's anything else their body is fighting as well, to have that being treated. And we know that that gives them a much better chance of survival. We've seen some online discussion as well indicating that perhaps ivermectin is useful in this case, but we have not seen any research that shows that ivermectin is an effective treatment for hantavirus, and that's what we know at this point. So just to reiterate, as we said yesterday as well, based on what we know, based on the dynamics of this outbreak, based on how it is spreading and not spreading amongst the people on the ship, the people who have disembarked as well, we continue to consider the risk as low for the general population. It's moderate for those on the ship. And we'll be following this closely, and we don't mean following this closely remotely. We actually have colleagues who are in the Canary Islands and will be working directly with Spanish authorities to have the smoothest process for the people on the ship and for the people of the Canary Islands as well. So thank you so much for watching. Thank you. I pulled you away. I think you had just pressed send, and I took you from your desk and brought you down here. So thank you very much, Anais.
Thank you, Nika.
Thanks, everybody.